acid tests tell us?
So what the organic acid test does is it shows things that fungus or yeast are making that the human body doesn't make. So if they're present, you know that there's a fungal infection somewhere in the body. And so then you can either just treat empirically with a systemic medication or herbal, or you can go looking to see if you can find out more exactly what it is.
That's right. And then, of course, we don't forget the basics, which is we want a basic overview of blood counts and hormones. Oftentimes we're doing an adrenal stress index. We're looking at thyroid. We're looking at, again, basic markers of things like B vitamin status and minerals. So basic blood work is a good way to assess, and then we can get fancier with doing organic acid tests, which can be urine and blood testing. We can do the various urine mycotoxin tests. We can get these indirect inflammatory markers that Dr. Shoemaker really showed us. We can get the blood IgG levels. There's a couple labs that I like, Allometrics and I think it's called Serolabs, and even LabCorp has. You can get those, and those are relatively less expensive screening markers if you're suspicious.
I really like to get a glutathione level because that's actually one of the common things that I see is that the glutathione's either gotten depleted because the body's trying to detoxify so hard if the person just doesn't make an optimal amount. So then we can use that to help guide treatment.
So again, those are some basics, and we'll be covering those again throughout the talks. Again, Marcel Pick and Scott Richmond will be talking about kind of men's and women's hormonal issues, and all the different practitioners will be touching on what testing do they like to use. One test that I do like to use that is part of Dr. Shoemaker's panel is a CD57. That's a marker for a suppressed immune system, and oftentimes we'll see that go down in chronic infections such as Lyme, such as chronic viral infections, etc. And those can all be symptoms, and again, that will be addressed through Jay Davidson's lecture, our talk, and Todd Watts talking about parasites, Evan Brand talking about candida and fungal overgrowth, Wendy Myers talking about heavy metals. That's another thing we can look at and test for. And this concept is of the total body burden. How full is your bucket with toxins, and is it spilling over the top? Do you have a spigot on that bucket that's big enough to drain it, or are you just putting a lid on it with medications and never fixing what's inside here? So the good news is that there's a lot of ways that we can approach treatment where you can get better even without necessarily leaving your home or moving out. So let's get on to, again, kind of basics for treatment and treatment approaches. Is there just one way to do this?
I bet every person you talk to has a different approach. Because we're all, we all see different things that work in ourselves and in our patients. So, but I think the bottom line is, to get the fire out as much as possible so that the inflammation starts settling down, to open up as many spigots as you can and not tip the bucket over, right? Because sometimes if you open it too fast, you can cause some flooding. So it's really finding that right combination of things between what people are eating with really having a low inflammation diet and what works best there and what you're willing to do as far as modifying your diet, and then find the supplements that really support detoxification, and then use medications when you need to. So I think, a lot of the, years ago when I had my serious mold run-in with the neurological things, the only treatment that was being talked about was Dr. Shoemaker's treatment with cholecystyrene. Well, I tried to take it and it just made me sicker. And so I think that was because it caused a lot of turmoil in my system, and I didn't have enough of the other things that would support me, like liposomal glutathione and binders that were not toxins themselves to really help to pull out the toxins.
Absolutely. So really what you're saying is that there is no consensus right now on what to do or how to approach it. Now, bringing together all these different experts who've been at the leading edge of talking about how to do this. We have various different protocols or processes, and most of us who've been doing this for a while in a clinical setting are using bits and pieces of all that. So you have Dr. Shoemaker's protocol, which he's the one who really talked about binders at first, and also using VIP, vasoactive intestinal peptide, at the endpoint of treatment. Throughout the summit, we'll be talking about different binders and approaches. We'll be having Dr. Dennis Cates at in one of the bonus interviews from Hopkinton Pharmacy, talking about the role of VIP and how that can work. So that's Dr. Shoemaker is one way to do it. Then you have the Dr. Brewer protocol, and he focuses so much on the upper respiratory and on the sinuses and on using antifungals. So Brewer has really brought in the whole antifungal perspective of a treatment using actually medicinal antifungals. Then you have Dr. Ray and the Environmental Health Center. And by the way, this whole summit is dedicated to Dr. Ray. For the pioneering work that he's done, and he passed in August of 2018, just the week I was supposed to interview him. So Dr. Ray has, especially with the super environmentally sensitive patients, there's provocation neutralization testing and ways to approach that. And again, he's using a lot of other biological terrain methods to do this. So, and we have Dr. Stephanie McCarter, who's worked with Dr. Ray for a long time, reviewing that protocol. And we have Dr. Klinghardt, who's just an amazing, amazing individual who practices both in Germany and here in the U.S. And he sees a lot of these chronic complex illnesses, Lyme, and he really talks about biologic terrain and how important it is to, again, healing that terrain. So we have Dr. Christine Schaffner talking about that and bringing in that approach to that, which is really the approach behind naturopathy. Also, there's acupuncture and oriental medicine and the chiropractic approach, all contributing pieces to this, looking at the whole big picture and how we have to. There is no one way to do this, and anybody who says my way or the highway, you want to be a revenant. I really wanted to highly mention also the PK protocol, Dr. Patricia Kane, and membrane medicine, and how important the role of using phosphatidylcholine can be in helping to repair damaged cells, and we'll mentioning that in a second. And most all of these protocols are involving the use of glutathione, the body's most powerful antioxidant detoxing agent. Again, when you do that, how you do that, etc., can be very variable. So that really covers some of the main systems, but the foundation, I think, is really from the naturopaths and that mentality of diet, lifestyle, nutrients, and that's really what and herbal medicine.
Yes, and I think one of the biggest things is finding the source of the mold. It's sometimes these things can help you to make some improvement in how you're doing, but you really do want to have your house or your school or office or your car or wherever the mold's coming from be a patient too. You really need to help.
Absolutely. So before we talk about the house as a patient, let's talk about just again the big picture, overall picture of the approach to detox.
So I think one of the important things too is realizing how much variability there is between people. Like one thing that worked perfectly for one person, may not be the right approach for the other. So I love it when we can get all these labs to really help to guide what to treat. But things like we talked about with overcoming some of the genetics and some of the toxicity, really repairing cell membranes, like with the phosphatidylcholine. And then, I also see just a lot of nutrient deficiency, like with the B vitamins and the magnesium. So making sure that the body has everything that it actually needs to do the repair. And simple things like you really need to have a bowel movement every day so that the toxins can exit your body, and you need to be drinking enough water so that your kidneys are working optimally, and make sure that your vitamin D is up. But I think getting sunshine is so good. Getting out in nature can actually really give the body the message, oh, okay, I can relax and I can do the work to repair and heal. So I think you've really touched on a lot of the things, what I consider to be the pillars of and how people can get that.
Yeah. So again, the kind of the basic big overall framework is that you want to clean out and irrigate sinuses. So if you're breathing this stuff in, you're not triggering it. You want to upregulate your lymphatic drainage systems, so your lymph system is draining well. You've got to, as you mentioned, we got to get the colon moving. We have to, there's all kinds of strategies that we can help with liver and detoxification there. And then, making sure the kidneys are working well. And then you get into more deeper issues, things like heavy metal burden, dental, chronic dental infections might be part of it. But there is a layering that has to happen, and because, like you said, if we start trying to detox somebody too quickly, we'll tip that bucket over and overwhelm the system. So there is a very specific way we need to start going after some of this stuff, starting more gently and revving up. And I love what you said about getting outside in nature and sunshine. Dr. Maya Shetreat, who's this fabulous neurologist, she's a pediatric neurologist. She's one of my guests. She talks a lot about kids, but everything she talks about kids and how to help kids overcome this can be applied to adults. And she really talks about the importance of nature and of sunshine and just getting out and moving and playing and how important that is.
So sweating, like when you feel well enough to get in a sauna and to exercise to the point where you work up a sweat, right? It's so helpful,
right? So again, in the very big picture, it's you try and remove yourself from the toxic environment as much as possible, or do what you can to decrease the toxic burden of that environment. You upregulate your own detoxification mechanisms, all those other things that we talked about. And then using some binding agents to help pull things out. And then we start using some repair agents to put in